What are some other causes for gestational diabetes?
Other causes aside from, like I mentioned, age, race and ethnicity, family history of diabetes also would be a personal or family history of polycystic ovarian syndrome, PCOS, because it has that same underlying insulin resistance going on. Potentially being at a higher body weight, like I mentioned, it could be a factor. And aside from that, yeah, there's no other real, causes of it. Those are kind of the big ones.
Okay. And so once a pregnant woman is, diagnosed with gestational diabetes, I should start calling it GDM too. GDM, is that
That's
what you
a
said?
mouthful.
I
Yeah.
know. I'm like, after a while, I'm like, okay, I get why you're kind of after they're diagnosed. What are some ways that they can better take care of themselves? Or I shouldn't say better, but things that they should alter through the rest of their pregnancy?
First step, and because every woman that gets diagnosed with this is different, every woman in pregnancy, is different. So first step I say is get your hands on the glucometer, get set up with your testing supplies so that we can actually get some data of your blood sugars. And that's going to be your best tool for how to adapt. There's certainly certain recommendations and kind of general guidelines that I'll walk people through. The big things being, and I don't like to use the word like never or always, like there's always exceptions to the rule. But, I think limiting things like juices or eliminating potentially even juices and sodas, like just not having those beverages, switching to water or seltzer water, trying to limit your intake of added sugars. So paying attention to different things like your yogurts and condiments and sauces and things like that to try to eliminate those sources of sugar. And then, those other whole foods, which, eating food is necessary in pregnancy, and eating carbohydrates and grains and starches is there's so much benefit to those in pregnancy. But I guess my best piece of advice when you get started is paying attention to how much you're eating of those foods, and really the quality, right? We want to be choosing more of these whole grains, high fiber types of carbohydrates and starches so that they don't spike your blood sugars as much.
How long does this typically last? Is it the same length for everyone? Does it differ? Does it go into after birth? What is the difference there?
Once you get that diagnosis around the 26 to 28-week mark, it's with you till the end. And we also know that just how the placenta works, glucose control can actually tend to get a little bit worse as pregnancy progresses. I usually see a big spike in people's numbers around 30 to 32 weeks, and that might be a time where they might need medication or insulin or something, but certainly not for everyone. So it is, lasting the duration of the pregnancy, but pretty much as soon as you give birth, right? If once the placenta is gone, which is causing a lot of the problems, blood sugars will pretty rapidly return to normal within, a few weeks or so.